Hi and welcome to my channel. We talk about all things beauty, makeup, skincare, hair care, all of it. So if that interests you, make sure you hit the subscribe button. Today I'm going to be talking to you about my breast reduction and lift surgery, which I had a year and a half ago in January 2022. I'm going to tell you exactly how the procedure was done, how it felt afterwards, the kind of care it required after the surgery, the doctor I went to, and if you want to know how much it cost, make sure you watch this video until the end. I talked about this video on Instagram and asked you to send me your questions and what you wanted to know about this surgery. So I will be talking about my surgery and also answering your questions along the way. Without further ado, let's get into the video. So now, of course, I can't speak for everybody, but for me, my main motive was to get a lift. A reduction was kind of like a secondary thing in my mind, but my surgeon explained to me that because of my size, it would make no sense for me to get a slight reduction as well, because that would give me a better lift and also my results would last longer. And that made sense to me, so I decided to get a reduction along with the lift. But I know people who've decided to get a breast reduction surgery because large breasts can be really heavy. They can cause back pain, neck pain, and also it does limit the kind of clothing that you can wear because you feel conscious about it. I'm not saying that people with big breasts can't wear what they want, but personally, me and the people I know, we all experience that level of feeling conscious in certain clothing, and that has reduced a whole lot since I got the surgery. Like, I'm able to wear clothing of my choice a lot more easily, and I just feel more comfortable in my body. Which doctor I went to and how I went about looking for the right surgeon. My surgeon was Dr. Milind Wagh from Make a Change Clinic in Mumbai. So I actually didn't have to look for him because my dad and Dr. Wagh are friends. So my dad recommended him to me, and I had the additional and very unique advantage that he had already operated on 2 members of my family before. I had seen that experience with him firsthand and the kind of results they had, the feedback that they had. So I already knew that he would be the right choice. But other than this, I also did a personal consultation with him where I let him examine me. I asked him all of my questions. I let him explain the whole process to me. And after this extensive interaction, I decided that I was comfortable with him and that I would want to get my surgery done from him. So if you are looking for a surgeon for such a surgery, make sure you shop around a little bit, talk to different surgeons, take your time, ask them a list of questions, see how patient they are with you, ensure that they are attached to a reputable hospital, that they make you feel at ease. If you are going for such a procedure, you are putting a lot of trust in your doctor. So you should make sure that you're putting that trust in the right surgeon. So you might be wondering exactly how does the surgery happen? So what they do is they make an incision around your areola. If your areola is too big, typically they will reduce it in size, and they make an incision downwards as well. And then they move your nipple upwards so that it's more up. They remove any excess fat and breast tissue from inside, also any excess skin, and then they stitch it up. Before the surgery, you can't eat or drink anything the night before. This isn't unique to a breast reduction surgery. This is true for any surgery. I had to reach the hospital a couple of hours before the surgery so that, the anesthesiologist could take my history, ask me whatever questions they had, and also the surgeon has to make physical markings with a marker pen on your body while you're awake. And then they do pre-op, like they put an IV and everything. And the surgery itself took about 2 or 3 hours. Then after coming out of surgery, I was in post-op for about an hour. So they gave me that time to, just sort of come out of anesthesia to make sure that everything is fine. And then they took me to my hospital room. And even after that, I was pretty groggy from the anesthesia for the first couple of hours. Now let's talk about the preliminary checks and the aftercare of the surgery. For the first 2 to 3 weeks after my surgery, I had to go in for a checkup every 4 to 5 days. So at these times, my surgeon would check the swelling, ask me about pain levels, ask me about any other concerns that I might have, and change my bandages as well. Eventually, on the 8th day, all of the bandages were removed, only the stitches remained. So while editing this video, I actually went back and checked, and my stitches came out on the 8th day along with all the bandages. But I did have to continue wearing a sports bra for compression 24/7 for 6 weeks. After 12 days, I was allowed to take the sports bra off for 15 minutes a day, just shower, clean myself. But after that, I had to continue wearing it all the time. Because after the surgery, sports bra offers a compression which helps to keep the swelling at a minimum. And honestly, it sounded like it would be hell when I first heard that I would have to do this. But after the surgery, I I actually felt very comfortable because while it's healing, it provides you that much needed support and just helps keep everything, secure, and you're not afraid that you hurt yourself by mistake or anything of that sort. It really helped that I wore a sports bra which had a front zipper. That made it comfortable because there was nothing poking me at the back while I was lying down, and also it made it much easier to open and close by myself. So if you plan to get such a surgery and your doctor tells you to wear a sports bra, which I'm pretty sure he will, do go for this sports bra. I will link it below in the description. And after 6 weeks had passed, I was cleared to go back to all normal physical activity. I could go back to the gym, lift weights, I could do whatever I wanted. I was healed enough by then. But I will say that complete 100% healing definitely takes longer than that. I didn't feel completely 100% like myself physically for at least another 4-5 months after the surgery. So a lot of you wanted to know about any disadvantages, cons, or long-term negative impacts of having this surgery. So I would say the biggest potential side effect is the loss of nipple sensitivity. It may or may not happen to you, and for some people the sensitivity comes back after a few months. For some people it doesn't. I have definitely noticed some loss of sensitivity in my case, and I do miss that. I wish it hadn't happened, but overall I would still say that it was worth getting the surgery, and I don't regret it or anything. And as for the scarring, there will most definitely be a scar in such a situation. The scar depends on the incision that your surgeon makes, depending on what your surgeon decides is the best for you. In most cases, it's either a lollipop scar, which goes around the circumference of the areola and then down, or an anchor scar, which is a lollipop scar but with an additional horizontal incision at the bottom. In my case, it is the latter, the anchor scar. The bottom part of the scar, the vertical line and the horizontal line under it, gets hidden in the fold of the breast, so it doesn't really show. But yeah, of course, the areola scar will be visible to you every time you look at yourself in the mirror. And the scar might be a little bit raised as well. Again, that depends from person to person and how your body heals. My surgeon told me that there is actually a higher possibility of a raised scar in younger people than older, because the more collagen you have in your skin, the higher the likelihood of a raised scar. So in this case, being young is actually somewhat of a disadvantage, but I feel like these are all very small things in exchange for what you gain from the surgery. And as for another popular question that people have in terms of the long-term effects of the surgery, if it has any effect on being able to breastfeed any future children, no, it doesn't, because this surgery does not touch your milk ducts or any of that plumbing, and you will be able to breastfeed your children in the future as normal if you decide to have babies. I personally don't want to give birth, but that's a separate topic. Now the question is, how safe is it? Every surgery comes with some level of inherent risk, but if your surgeon is a reputable, experienced surgeon, if they know what they're doing, then I don't think there should be any problem. I was personally not afraid at all to go into the OT, because even though I had never had a surgery before, I trusted my surgeon. I had spoken to him many times before. He had operated on other members of my family, so I was completely at ease in that aspect. So the next question was tips to deal with scars after surgery. So honestly, I haven't been that bothered about my scars because, as I said, a large part of it does get hidden in the fold of the breast, so I don't even see it that often. Even the one around the areola, it's kind of part of my body now. I'm used to it. Your scars will fade quite a lot over the years as your body heals more and more, and there are pretty effective scar creams out there, and my surgeon did prescribe me one. But you will have permanent scars from such a surgery. Another important aspect of the surgery is whether this is painful, how much does it hurt, etc. Obviously, if you're getting a surgery, especially a relatively invasive surgery like this one, there will be some amount of soreness and discomfort. But I wouldn't say I went through much pain at all after the surgery, because my surgeon prescribed an excellent pain management regimen for me. It's a combination of stronger and milder painkillers, and together all of it took care of my pain really well. Had discomfort, I would say I didn't even have much pain, and especially right after you wake up from surgery, you're gonna have IV painkillers, so you're gonna be so numbed out that you're not gonna feel anything. And even after coming home, I was taking pills like oral painkillers, and all of that kept everything under control, and I was just fine. So if you're afraid of the pain, don't let that be a reason that holds you back from getting the surgery. It's really not an issue in my opinion. So I'm sure you're wondering how much this surgery must have cost. So it actually cost me around 1.7 lakhs. This included the surgery as well as one night stay at the hospital, which is a minimum requirement after such a surgery. So ultimately, would I recommend the surgery? If you feel like you could benefit from a breast reduction and or a lift, if you can find the right surgeon for it, I definitely recommend doing it. Whatever negatives there are, like the scarring and the potential loss of sensitivity, in my experience and also in the experience of the people I personally know who had this surgery, it is completely worth it. If I had to do it all over again, I would definitely do it. So I hope you enjoyed this video and found it informative. If you are considering getting this surgery done and if you have any doubts or questions, please leave it in the comments and I will be happy to answer them for you. Don't forget to hit the subscribe button and I will see you next time. Bye.